Good evening. My name is Kamryn Allen, and my presentation is going to be on chlamydia and trachomatis. We will discuss the cause of chlamydia, the history. We will discuss the formation, process, and transformation of chlamydia and how it persists in an individual, and we'll discuss the treatment options for prevention of chlamydia. For the history, there is no hard, conclusive evidence of when it was discovered exactly, but it has been traced back to before or at 15 BC, and it has been appeared by the ancient Egyptians and Chinese people, and they have found a lot of chlamydia-like diseases. It has also been heavily researched in 1907 by two scientists named Ludwig Halberstaedter and Stanislaus von Prozac. They are one is a German dermatologist and another is an Australian bacteriologist, and they discovered the bacteria that is held in the conjunctiva in the eye. They researched a good bunch of orangutans, and they have found solid evidence of this disease. The epidemiology of it, the incidence and prevalence is 1 in 40%. That is pretty big concerning a sexually transmitted disease. Between the ages of 15 to 24 years old, 4.9% are infected with this disease, and unfortunately, women are 3.5 times likely to have this disease more than men. In the United States, over 800,000 cases were found in 2002 and has drastically risen by 347.8 cases per 100,000 people. New research concerning the racial demographic, chlamydia in African Americans were 6 times more likely to get six times more infected than whites. And whites, Hispanics are more likely to get infected than whites. The pathophysiology of chlamydia. Chlamydia trachomatis bacteria is transferred through sex or contact with genital fluids. So in any case, unprotected sex, whether it is vaginal, oral, or anal, can be spread through fluids of the genitals. The bacteria will then invade those fluids and start to go through a process called endocytosis, and that's when the cells take substance from the outside of the cell and will start engulfing them in a vesicle, and they will end up being within the body. The antigen, or the elementary body, which is an infectious particle of a microorganism, it will attack the host in the superficial columnar cervical epithelial cell in the females, so basically in the cervix, or the urethral epithelial cells in the men, so in the urethra for men. These elementary bodies will then get phagocytosed. They will get eaten by the host white blood cells. They will bind onto pituitative light glands and induce internalization of the pathogen. Inflammatory process is then called, and it is initiated, and it starts the formation of bacterial membraneless organelles, or LLPS, which is liquid-liquid phase separation, and this is when membraneless organelles start to separate. The infection site would then start a list of symptoms such as painful urination, discharge in the vagina or the penis, pelvic pains, and also inflamed red swollen testicles. The phagosome containing the chlamydial cell will then use the nucleus to extract its nutrients and proteins to survive. So that's how the bacteria of chlamydia trachomatis persist in the individual, it will use the nucleus to extract, and it will use all of its sources to survive and continue to spread throughout the body. The elementary bodies would then start to differentiate into non-infectious reticulate bodies. The difference between elementary bodies and reticulate bodies is that elementary bodies aren't metabolically active, but when they infect this host and it turns into reticulate bodies, the reticulate bodies are metabolically active, but it isn't infectious. Continuing using the cell for survival, so using the nucleus and extracting its sustenance, it will take proteins and then replicate the RBs by separation of the bodies into two new bodies and a continuous cycle. This is called binary fission. It's an asexual reproduction by the separation of one body, and it will separate into two new bodies. After about 40 to 72 hours, the intracellular development phase will have finished and concluded, and then start to convert RBs back into EBs to be released by lysis or cell destruction. So they will take some RBs and they will convert it back to EBs so they can start to attack other cells and start to infect other areas of the body. The infectious cell will then exit from the apical end of the epithelial cell to find the other host, white blood cells, to attack and infect. They will start going through necrosis and apoptosis, which is cell death. That means it will stop working. Nothing is going over there anymore. And it will start to shrivel and start to die. And it will continue that. Symptoms and treatments. The symptoms, as I said before, painful urination, vaginal or urethral discharge coming from the vagina or penis. If it's from anal, rectal pain, pain and swelling in either one or both of the testicles, or an unusual odor can happen. Usually these symptoms aren't, this disease is called the silent disease because most people do not have symptoms, but when they do have symptoms, these are the symptoms that they will have. Long-term problems for chlamydia. There's a lot more problems in female than it would be for a male. Pelvic inflammatory disease, which will cause the fallopian tubes to start to be blocked, will start to block up. It will cause ectopic pregnancy, and it will also cause infertility. Epididymitis, which is an inflammation of a small coiled tube at the back of the testicle for men, or reactive arthritis. Treatment, there isn't any other treatment other than antibiotics. Antibiotics can treat chlamydia. Doxycycline and azithromycin is basically, it treats infections by preventing the growth and the spread of the bacteria from these elementary bodies to host and extract all the nutrients from other cells of the body. Some interesting facts. Well, this should be a no-brainer, but should you be tested? Absolutely. You need to be tested at least a year if you are younger than 25 years old, or if you have more than one partner at a time. Pregnancy, having chlamydia trachomatis, if you are pregnant, can spread to the baby, and this can end up them having the baby early, or having problems with the baby, such as eye infections and stuff like that. This can also cause pneumonia in their child if they do have this disease. Are we immune to chlamydia? Absolutely not. This can happen again if you are treated for it. Um, if they continue with the bad decisions of uh, no protection or stuff like that, they can get it again. And if this keeps persisting, can end up eventually causing long-term problems in women and men. There has been new research. I've looked it up. There's new research that they've been making a vaccine for chlamydia. They have passed. They went through their first trial, and the first trial was very promising. They said there was a lot of good results in the chlamydial vaccines. Summary, there isn't any hard evidence, again, of the chlamydia, of when it was discovered exactly, but it has been found to go back at least since BC. So it's been here for a very, very long time. The pathophysiology of chlamydia will bind, invade, and attack other cells to continue to persist until treated. So unless it is treated with antibiotics, it will stay within the body and it will continue to attack other cells and it will continue to extract other nutrients from nucleuses and stuff until it has been treated. Symptoms are minimal. Most of the time, symptoms are very asymptomatic and won't show, but this can also bring long-term problems if it's not treated. With this silent disease, it can it's a very higher risk that long-term problems can persist in individuals. And antibiotics are the only treatment for this disease. I have looked and there's no other treatment for it. So here are my references, and thank you.